You guys have now watched the cardiovascular system video and the importance of that system, how much goes into that system, and why it's so important to keep it healthy and strong. This cardiovascular disease is also going to put in your mind why that system's so important to keep it healthy. We're going to go over some of it and so that you can see the benefits of keeping your cardiovascular system strong. Cardiovascular disease is the leading cause of death in the United States. Crazy, roughly 40% of the mortality rate in 2005 was cardiovascular disease. Cardiovascular disease of any aspect of the cardiovascular system, which includes your heart, blood, and blood vessels. So it's any of that included in there is cardiovascular disease. Some of the major forms are high blood pressure, congenital heart disease, coronary heart disease, peripheral vascular disease, stroke. We're going to talk about a lot of these. Okay, we're not going to talk about all of them, but we are going to talk about some of them through this slideshow. The most predominant form of cardiovascular disease is the coronary heart disease. So it's huge. Coronary heart disease is the single largest killer of American males and females. So this is our number one death. Another reason so important to create a healthy lifestyle to keep this system and to avoid these diseases. Heart attack. When your CHD causes the arteries to be closed, okay? Look at the picture, it closes it off. And that's what's happening, is that your heart is not getting the blood it needs and it's not giving it to your body the way it's supposed to. That's a heart attack. It occurs when the blood supply to the part of the heart is blocked. And this is typically brought about by a blood clot forming in a narrow coronary artery. And there's a lot of things that cause this narrowing that we'll talk about more. The first indication of a heart attack, maybe one of the several warning signals, is that you're uncomfortable pressure, your fullness, squeezing, or pain in the center of the chest. You've seen either in movies or have heard of these things causing pain, dizziness, fainting, sweating, nausea, and a shortness of breath. This all can be signs of a heart attack. Coronary heart disease. A heart attack that we talked about, a blockage of normal blood supply in an area of the heart that causes permanent damage. Here's just a picture to kind of show you these symptoms that you'll see. Definitely things we want to avoid, and definitely things that if we can help to avoid them, we want to apply in our lives. Look at these veins, arteries down here at the bottom. A healthy artery, see how open it is. That's figure A. Figure B is when we start getting the atherosclerosis, where it starts, and then we have the severe disease in figure C, of when that blood is hardly pumping through. This is what's causing heart attacks, is that there's a blockage in these arteries that are going to and from the heart. Here are some causing signs or risk factors of these cardiovascular diseases. Excessive body fat, diabetes, smoking is a huge risk factor in causing cardiovascular disease, physical inactivity, tension and stress. Even stress in your life can cause this disease. Personal and family history, it can be part of a genetic thing. Age, other factors, gum disease, loud snoring, stuff like that. But all these things, a lot of these things you can take care of yourself. Activity, smoking, body fat, these things. There's type 2 diabetes that is a lot with overweight and stuff like that. Now, family history, personal, if you know of history, then you definitely want to be doing things to prevent it, like don't smoke or or make sure you're physically active, stuff like that, so that you can prevent this from happening to you. They do have a surgery where what they do, it's called a bypass surgery, where they're going to take a blood vessel from a leg. Usually it's from a leg where they take it, and what they do is they take it out of your leg and they put it into your heart and replace it with one of your veins there, or arteries that is clogged. So this is a surgery that they do. Definitely not something you want done, but it is helpful for those that need it. Once again, just wanted to show you these pictures. This is what they do, is they put kind of a balloon type deal inside of your arteries and veins, and they blow it up to unblock the artery to make the blood flow through it. So this is just another view of how bad an artery can get, and another type of surgery that they use to try to keep you from having heart attacks and keeping you healthy and away from these diseases. Now, stroke is another thing that can happen if your cardiovascular system is weak, if you're not keeping it healthy and strong. What stroke is that your brain is not getting oxygen and other nutrients to it. So it's a blockage as well. Narrowing of the arteries due to the buildup of deposit in the arterial wall. These are also ways that can cause a stroke. This also, you're going to get dizziness, temporary weakness, or numbness. It can cause memory loss. It can cause your body to not work right. It's not good to have no oxygen in your brain, and so it can cause a lot of problems. And just be aware of warning signs, and like, once again, activity is one of the major keys. Healthy eating is one of the major keys avoiding these. Here's some risk factors that can be treated. High blood pressure, your history. Like I said, if you know your history, you can not smoke. You can make sure you're physically active. Avoid excessive alcohol intake, obesity, all these types of things to keep yourself healthy. Some of the things that cannot be treated are age, your ethnicity, hereditary, stuff like that, but you can help in aiding in those things by proper diet and nutrition. I want to talk about smoking and why it's so important. Smoking is the #1 cause of CVD. Individuals who smoke have a 2.5 times greater than average risk of developing CVD. Smoking is so bad it can cause cancers. A strong relationship exists between the development of CVD and smoking. This means that the more you smoke, the greater your risk. 1 pack a day smoker is twice the risk as a non-smoker, while 2 pack a day smoker is 3 times the risk. Smoking is the #1. At all cost, avoid this. Saturated fats are also, I talked about having a healthy diet. Saturated fats, they're found a lot in animal food. You can look at the content in the food you're eating and it will tell you the saturated fats. These are things you want to try to stay away from. They're going to be in a lot of the things that you eat, but try to keep it at lower levels, because this can cause the blockage in your heart, your arteries, those veins. Other risk factors we kind of touched on: stress, gender, hereditary. Be aware of these things. Find ways. We're going to talk about more in this course of stress and why that's so important to keep it low, and how exercise eliminates that stress in your life. There's other risk factors in our next slide that we want to talk about as well. Other risk factors can be race or age. Now, with all these risk factors, that's why it's so important to create your habits now. And what you do today truly does affect your future. So, it's important to treat your body right, to get this system functioning appropriately, and find a way to keep it healthy and strong. Implement this into your life. Understand why it's so important to have exercise, even if it's just a little bit. Apply it to your life. Find ways to be successful and utilize it in your program that you're doing now. Find your goals and reevaluate to see how you can be successful with avoiding these types of diseases.